you're somebody who struggles with anxiety, emotional instability, feeling emotionally overwhelmed or overstimulated, sometimes it's not just stress and trauma. There is a mineral imbalance, which is commonly known in the naturopathic or functional medicine space, that contributes to neurotransmitter balance, but also how we respond to stress in our environments. What I'm gonna do is cover that mineral imbalance today, which is the zinc to copper ratio, which is something that I avidly test for in patients who are experiencing stress, anxiety, depression, brain fog, and overall inflammation. So stay tuned, we're gonna be talking about zinc and copper and how it influences your mental health. So let's talk about the role of zinc in the brain. Zinc is very important for nervous system health. It keeps us calm, cool, and collected, and is very important for overall nervous system regulation. Zinc has 4 key functions, which include the production of those neurotransmitters or brain chemicals. It also helps create GABA. It reduces brain inflammation and also helps us with stress response. It's very common in this population that I see low zinc, which will cause a low zinc, high copper ratio, which will often lead to those symptoms of anxiety, racing thoughts, depression. Very common for this population with people with low zinc to have brain fog, brain inflammation, anxiety, depression, low mood, low emotional resilience, and emotional instability. So now let's talk about copper and the role that it plays in the body. Now, copper is important, but what we want is a balanced ratio. So when zinc's deficient, oftentimes we get excess copper states. The problem with copper is that it's very hypersensitive in the sense that higher levels make the nervous system overwhelmed. And that's what leads to copper toxicity. There are certain states that can cause this copper imbalance, like oral contraceptive, HRT, or excess estrogen, because copper is estrogenic. But what happens when we have that high ratio of copper, what I start to see is hypersensitivity of the nervous system. So we get racing thoughts, we get anxiety, we get on edge, we get palpitations, we feel like we can't calm ourselves essentially. Those are signs that copper might be high in the body. So you might be wondering, how is copper becoming elevated in the body? Like I said, a lot of different things like oral contraceptive, which are hugely mainstream right now, as well as excess estrogen can cause that build. The other problem is that a lot of our soil is zinc deficient, and a lot of people are not eating enough food that is high in zinc, leading to that low zinc deficiency. I see this a lot in clinical practice. There's an obvious sign that I see on the nails that show me that somebody is actually zinc deficient and potentially dealing with cryptopyrroles, which is a whole other ballgame. But the reason that copper is usually high is because of our low zinc, which is that deficiency state, which is causing the copper excess. Another area where somebody might be experiencing excessive copper is from their pots, pans, cups that they're using, or old copper plumbing. Another one is environmental concerns. So when the liver becomes sluggish, which is what we often see in oral contraceptive or HRT, we get an increase in copper due to the lack of excretion. Like I said, copper is actually important, but when it's elevated and when zinc is deficient, then it becomes a problem in the body. So let's talk about something that's very important, and it's called the zinc to copper ratio. And where I first learned about this was actually Dr. Walsh, Bill Walsh, who has been a physician or a biochemist for about 30 years. He deals with mental health and works specifically on mineral balance. And with this zinc to copper ratio, like I said earlier, is that narrow ranges are what we're looking for. So you do a simple calculation from zinc to copper, and you look at the ratio between the two. When I say narrow, you want them relatively close together. When you have a zinc deficiency state, depending on where you are, some of it could be 8, 9, 10, 11, and copper could be upwards of 20, 22, 25. That's a massive range between zinc to copper. If you've got an 8 and you've got a 22 copper levels, you're going to see that excess copper state because there's going to be so much copper swimming around in the circulation that you're going to get that hypersensitivity state of the nervous system. Plus, you don't have that zinc to help create that GABA and calm the nervous system down. The other thing with copper is that it's more prone to the production of dopamine and norepinephrine, and zinc is for serotonin and dopamine. So serotonin is more of a calming neurotransmitter, where obviously norepinephrine, being adrenaline, is going to keep you in a more wired state, right? Which is often the people, if they do have excess copper, you're seeing kind of that wired or tired or wired and can't kind of slow down because their nervous system is so overstimulated with the copper. So oftentimes what I see with this ratio is when I'm looking at the zinc to copper and I do have a ratio that's relatively off, meaning the copper is high. I see this commonly in ADHD, people with chronic stress, PMDD, postpartum, and overall emotional instability or dysregulation. So at this point, you're probably wondering, how do we evaluate these levels and how do we know where our minerals actually are? Oftentimes, I will actually just complete a blood test, which is a zinc to copper ratio in the blood. There are certain parameters, plasma versus non-plasma RBC levels, but overall, the serum does give me a good indicator of where people's zinc to copper ratios are. And then, like I said, those physical symptoms that I can often see on the nails, as well as the clinical presentation that I'm seeing with the patient. I also love an HTMA, which is a hair tissue mineral analysis that gives me an overall, essentially, analysis of what's going on in the body at their mineral levels. So where is zinc, where is copper, where's sodium, where's potassium, where's all of the other nervous system regulators that might be off. It's very common for me to see a zinc to copper ratio that's off paired with a potassium and sodium that's also relatively low. So all of those minerals that are supposed to be calming us are usually not there, either due to chronic stress, emotional stress, inflammation in the body that has been there for a long time. So now you know a lot about the zinc to copper ratio, and you're probably wondering, what do we do about it? Oftentimes when I see the low zinc, I will correct it, but sometimes I will also correct the high copper to get that person out of that hyperstimulated state in order to get them feeling good while I fix the imbalance. This often includes repeat testing, whether it's a 3 to 6 month period of where were we versus after treatment, how did we get? The other thing that we like to work on is lifestyle and nervous system regulation, making sure that the person is eating well, making sure that they're taking care of their stress levels that are causing the issue, and also making sure that that nervous system is actually balanced and regulated and not in a hyperstimulated state also while we're trying to heal it. Ideally, what we start to see is improvements in sleep, more restorative sleep, less anxiety, more emotional resilience and stability, and the person overall feels like they have a better handle of their nervous system and their health. The big part is the chronic stress that is causing the nervous system to be thrown off, either from the hyper copper states or from their environment. When you get that under control, the person just feels like they have control of their life again. I'm a firm believer that root cause matters and that dealing with mineral imbalances is a way to overall help the person instead of dealing with just the neurotransmitter level. What you can see is that mineral imbalances have physiological responses. And when you fix the mineral imbalances, we fix the physiology, which could be the anxiety, depression, brain fog, and inflammation. If you're gonna go in and you're gonna treat just dopamine or just serotonin, you're gonna mask the problem at the mineral level, which is why, in my opinion, root cause matters. And that's a wrap. My name is Dr. Vicino. I'm a naturopathic doctor who specializes in neurodivergence and mental health, and I help neurodivergent brains thrive through minerals, chemistry, and other support. So if you like this video, let me know in the comments. If you would like me to cover any other topics, I would also love to know, and I'll see you guys in the next video.